But first, there's grim news in Nova Scotia when it comes to the suicide rate. 2021 saw the highest number of people ever take their own lives in the province. There were 142 deaths last year. Dr. Simon Sherry is raising concerns about this statistic. Dr. Sherry is a clinical psychologist in Halifax and a professor in the Department of Psychology and Neuroscience at Dalhousie University. And a word of caution, our conversation centers around suicide, which could be triggering for some. Dr. Sherry, thanks very much for joining us.
Good afternoon, Bob.
Awareness of mental health challenges has never been as widespread as it is now, but the suicide rate still climbs. What concerns you most when you see that 142 people died by suicide last year in Nova Scotia?
It's alarming because that is a historical high in the available data. It's also alarming because that means roughly every 72 hours, one Nova Scotian is dying by suicide. I think the isolation, the confinement, the sedentariness, the employment problems, the child abuse, the domestic violence, the marital difficulties, the depression, anxiety, all of the messiness of this pandemic has caught up with us.
When you look at the numbers, say from 2019, it's 137 deaths. From 2020, which is part of the height of the pandemic, it's 121 deaths, and then it jumps up to 142 in 2021.
That's part of a trend observable throughout the Western world and throughout most provinces in Canada. During the first waves of the pandemic, death by suicide dropped. In particular, in the first few months of the pandemic, death by suicide dropped. We're not entirely sure why that is, but plausible speculations would include some sort of a coming together and pulling together effect where, as a society, we were working to combat COVID-19, and that may have had a unifying effect. I'd also point out that social safety nets were in place and programs to buffer against the adversities and impacts on an economic level that COVID-19 brought were in place, but necessarily those programs have now faded out. So we've gone from a decrease in death by suicide in 2020 to our highest levels to date in 2021.
What do the numbers tell you when you break them down by gender?
Suicide in Canada, and indeed around the entire world, is predominantly a male problem. In Nova Scotia in 2021, that means 106 men died by suicide and 36 women died by suicide. So this is very typical for Nova Scotia, for Canada, and for most of the Western world. There's a gender imbalance there where men are dying by suicide more often than women. In no way, however, do I want to be dismissive about the importance of death by suicide for women. For example, women often have more suicide attempts and more suicide ideation and more presentations to our emergency rooms for suicide. It's that when men attempt suicide, they tend to use highly lethal means, such as a gun or some sort of asphyxiation or hanging. And so more men die by suicide when they make an attempt. And there is an alarming trend across Canada to see more women dying by suicide. So even though the stats suggest this is mostly a male problem, we should be careful to track its impact on females.
So there's 121 suicides in the year 2020, 142, a significant jump in the year 2021. As you look forward to 2022 and beyond, what are you expecting? What's your professional opinion about what likely is to happen here if none of the variables change?
My hope is that the variables will change, and I'll give you an example. Last week, Quebec announced they dedicated $65 million to suicide prevention in their province, and their target, which was publicly announced, is to almost immediately, within the first few years, achieve a 10% reduction in death by suicide. So one point I want to emphasize is that we do not need to accept these outcomes as inevitable. Suicide is a preventable program, especially when there's a coordinated government-led initiative targeting a reduction of suicide. Unfortunately, we have already evidence that we're on trend for a similar number of deaths by suicide in Nova Scotia in 2022. Our coroner's service has done an outstanding job of more rapidly reporting death by suicide, and you can see a continuation of the trends in 2021 already being observable in 2022. So the problem here is unless we do something about it, this suicide crisis in Nova Scotia is going to continue.
So you mentioned the Quebec government poured $65 million into this. You also said that a lot of the social safety nets ended or fell away from the height of the pandemic. What specifically would you like to see happen then in Nova Scotia?
It's time for our provincial government to lead a suicide prevention strategy that involves real timelines, earmarked funds, and purpose-driven action. And it's quite clear from science what we might do to reduce death by suicide in our province. For example, responsible media reporting is part of a strategy to reduce death by suicide. Access to care is vitally important for people who attempt suicide. We need to connect people to evidence-based psychological interventions and pharmacological interventions to help protect them in the wake of a suicide attempt. Critically, we need to work on what's called means reduction. Means reduction is our best supported approach to reducing death by suicide. And through a means reduction approach, what you do is limit access to the means by which people die by suicide. So this could be taking away firearms for someone who was experiencing suicide ideation. This could be limiting access to drugs and changing the way they are prescribed so people don't have access to levels of medications that can result in fatal overdoses. This can mean putting up barriers on more bridges, so you actively restrict access to the means by which people die by suicide. We also need to improve family physicians training and psychologists and psychiatrists and other helping professionals training about how they can combat suicide ideation and behavior, including suicide attempts.
We hear about backlogs in the healthcare system as a result of the pandemic. How readily available is mental health care at this point in Nova Scotia? What are the wait times like?
In both the public and the private system, the wait times are brutal. You have professionals working overtime, extremely dedicated within our province, but the bottom line is our healthcare providers are overwhelmed. We lack the resources to deal with the negative mental health consequences arising from this pandemic. And indeed, prior to the pandemic, our mental health system was already stretched and strained. So what we're seeing here is an exacerbation of a pre-existing problem.
Are you seeing trends in your own practice, sort of maybe the lingering effects of this pandemic? Are you still seeing it yourself?
Our clinic, like most private practices within Nova Scotia, is completely overwhelmed. It is heartbreaking. We turn away many referrals every week. We've already stretched beyond our capacity, and we've been proactive about trying to bring new psychologists to Nova Scotia. The trend I would see is actually alarming. I had hoped, I guess in hindsight, naively, that as restrictions were loosened, as we were allowed to re-engage with our world and previously enjoyed activities, that some of the mental health consequences of the pandemic would lessen. In contrast, what I'm seeing is lingering effects from the pandemic. After 2 years of a narrow existence where the usual behavioral antidepressants we connected ourselves to, whether that was recreation or socializing, have been gone, that has actually changed our brain in such a way that it's rapidly not going to change back. This is an idea of neuroplasticity. Now, the good news is that if after 2 years our brains can change in a negative direction in response to all the stress and hassles of this pandemic, it's also the case that over time our brains will change in a more favorable direction as we reconnect to people and previously enjoyed activities and adventures. But I think what I'm learning is that it's going to take a longer time than I had hoped for us to recover from the ill effects of COVID-19 and this pandemic mess.
It's a difficult lesson to learn. Thanks for your time here today, and we'll keep an eye on these numbers. But thank you very much for your insight.
I appreciate you shining a light on this important issue, Bob.
Take care.
Goodbye.
Dr. Simon Sherry is a clinical psychologist in Halifax and a professor in the Department of Psychology and Neuroscience at Dalhousie University. If you or someone you know is experiencing a crisis, Canada's suicide prevention hotline is 1-833-456-4566. That's 1-833-456-4566.